The first bill we have on the agenda is House File 1075. This is Representative Backer's bill. Welcome to the committee, Representative Backer. I will move to lay over House File 1075, and I see that you have an A1 amendment. I will move your amendment, and would you like to explain it to us, please?
Yes, thank you, Madam Chair. A1 amendment really talks about the funding source. I've been working on this for a number of years, and it changes the funding source to the from the general fund, working with the Department of Public Safety. This is really the best, and other stakeholders. We needed to get the bill in order per what we're seeing fiscally this year. So that's what the amendment does, Madam Chair.
Thank you. Any discussion to the A1 amendment? Seeing none, all those in favor of the A1 amendment signify by saying aye. Aye. Opposed? The motion prevails and the A1 amendment is adopted. Now, Representative Backer, please tell us about your bill as amended.
Thank you, Madam Chair and members. As several of you know, I volunteer as an EMT for the Browns Valley Ambulance Service. So communication in all EMS, police, and fire is urgent, not just to provide care for our patients as an EMT, but also for the safety of those individuals who are providing that public service. This here is just some of the letters to support this. We have roughly 91,000, that is correct, 91,000 active radios in Minnesota. Working with the Department of Public Safety, 60% of those current radios are out of date, and they cannot find parts for them. So we are at a point that communication for when your constituents call 911 may not, those emergency technicians, fire, police may not be able to communicate. Just a little history, prior to 9/11, we could not communicate. For example, if I needed to talk to the fire chief for help, because some of my area as an EMS goes into Ortonville's area, our ambulance, we could not. But after 9/11, I could be in Browns Valley, Minnesota, and if I wanted to talk to someone in Duluth, I could. That is extremely powerful. And 2 years ago, we had a situation in the Clinton, Minnesota, that we had an elevator fire, and we had 19 agencies that were able to communicate. That's phenomenal. It saved the town. It saved lives. And that is something that we as legislators, it is very important for us to provide good public safety. So if you take 60% of 91,000 active radios with the low average cost of $4,500 per radio, that comes to $245 million just to replace things that are outdated and so forth. So I'm glad that the other body has heard this bill, but the $5 million that the other body has put aside for this bill doesn't really do what we need to do to provide the public safety what our citizens come to expect. So with that, I'm going to turn it over to our testifier. I know we have roughly 10 minutes, so I'm going to turn it over to Chief Henderson from the Ortonville Fire Department. If you could come up.
Yep. All right. Great. Yeah. Thank you, Chief. Please introduce yourself and begin your testimony. Welcome to the committee.
Hi, my name's Charles Henningsen. I served 21 years in the Minnesota National Guard, 2 tours to Iraq. I'm currently in my 22nd year of the Ortonville Fire Department, and my 4th year as a chief there. To explain the importance of the armor system in our area, I'm going to walk you through a hypothetical call. It's a 2-car head-on collision with 4 injuries on the far side of our coverage. The call goes out simultaneously to Ortonville Fire, Ortonville Ambulance, Big Stone County Sheriff, and the Life Flight to a vicinity 14 miles from our fire hall. Immediately, all the entities would realize that we need backup due to the distance and the amount of victims. Then we'd call for Odessa and Clinton Fire, Appleton Ambulance, Millbank Ambulance, and Stevens County Sheriff. These range from 17 to 30 miles away. We haven't even started helping victims, and we have 9 separate agencies responding to this one call. Without the armor system, no one could communicate. We could not land a helicopter at the scene, and the chance of getting patients to advanced care in a golden hour are almost nil. The armor system doesn't need line of sight, like Representative said. These towers communicate with Without this, we can only talk to the radios within a couple miles, making it possible to talk to other departments in our coverage. These radios are force multipliers for the distance of our coverage zones and smaller departments. This radio quit working 2 weeks ago at a call to the Ortonville school. We have 10 left. They're obsolete and not be able to fix. Last year, our fire protection charge per township for 36 square miles was less money than this one radio. We have no way financially to replace them when they break and keep up the maintenance of the rest of our equipment. A good example why I think this is necessary for all the emergency responders is if you read the after-action review of the Texas school shooting, the criticism of the Uvalde police chief was he took his weapon instead of the radio into that school. This caused a lack of communication that caused even more confusion, time wasted, resulting in more loss of life. This illustrates the importance of a multi-agency radio system. Without state-level funding, we're not able to access the advantages of the armor system in the future. Thank you.
Thank you for your testimony. Next up, we have Rebecca Young. Welcome to the committee. And when you make your way to the table, please introduce yourself and begin your testimony.
Madam Chair, members of the committee, thank you for allowing me to present on behalf of House File 1075. This has been a multi-year effort to try to get some funding for our rural radios. I think the chief demonstrated a very, very great case of how that can help. I work directly with our emergency manager, who's our local armor systems administrator. One of the very first things I got asked when I joined public service 9 years ago in my role was how are we going to get these paid for and how quickly can we get these replaced? As you know, armor radio system is the backbone of public safety and emergency response across the state of Minnesota. Continuing to provide a high level of service in our best response, we need law enforcement, EMS, first responders, and firefighters to have maintained equipment that's up to date. Armor radio system was a mandate that was given to local governments and other agencies across the state. The goal was interoperability to provide the highest level of safety and response. And guess what? It does work. We test this annually during our emergency management exercises and during actual emergencies. It allows for seamless delivery of services that would not otherwise be possible. One of the biggest challenges that you've heard is the funding and the cost associated with maintenance and repair. Well over 10 years ago, our county received a large grant that allowed us to transition over to armor. During that time, our emergency manager has been diligent about applying for small grants since then, and when she can, the county board also levies and supports replacement. But it's been a couple of year 2 to 3. Even with that concentrated effort, Stevens County alone is looking at a total replacement cost of $996,000 for a complete system upgrade. There are many counties that have not even had the luxury to levy and be able to do this on an annual basis. Granting funding to the armor radio replacement is equal to direct property tax relief in a county of our size. If we were to levy for that, the system replacement would be about a 12.5% levy increase, and then ongoing funding of a 2 to 3% levy impact. Another area of need that the chief spoke about is our rural emergency response departments. These are largely ran by volunteers. These departments have inadequate funding sources. They looked at partnerships with local government for funding, or they fundraise personally for it in their communities for their equipment replacement and their operations. Granting funding would help these small agencies stay viable and allow them to provide critical services to our rural population. Replacement radios can cost anywhere from $2,500 to $6,000 a piece, depending on type and need. On top of that, they need multiple battery replacements and programming. Radios purchased years ago by agencies all across the state are reaching the end of their useful life. Not only that, but the support of the products is not available, and neither is replacement parts. There's a critical need across all 87 counties for funding to update this quickly aging systems. All of us, we are all partners in public safety and emergency response. And to continue to provide a high level of service and response, we need your help and agreement to help fund this aging system. I urge you to consider supporting this critical piece of infrastructure for our future. It will save lives, speed response time, and allow counties and agencies all across the state to provide the highest level of response. Thank you.
Thanks for your testimony. We did not have anyone from the public sign up to testify on this bill, so we will move to member discussion. Representative Hewitt.
Thank you, Madam Chair, and Representative Backer, as I'm a co-author on this, I understand the need, as this is my space, and part of the need here is also the overarching fact that funding for EMS, fire, and police in outstate is not substantial. Radios are such a key factor to what we do, and I remember back in the earlier days, oh, the cell phones are going to come, we can get rid of these radios. Well, we tried that, and it didn't work at all, because when you need somebody on the click of the radio, and you need help now, and that's why we're still using radios for that sake. It's unbelievable when you've been in a situation where it's inoperable, and I can understand the fact of, especially in your area, Representative Backer, and in that western part, where you could easily be 100 miles from a hospital, and you need to talk to the doctor, and you need to get some orders. And when you have a radio that really is from the 1980s that isn't hitting the towers or whatever, you're in trouble, because now it leaves you totally blind to what you have to do for that patient. The same thing for law enforcement, the same thing for fire. The incident command system that we have is built around constant communication, everybody being on the same page, and when we don't have our communication network, it's a problem. The other factor here is, and I think we have to look at the attention here of the $250 million that you asked for in the bill. That's a substantial amount, and the sad thing is that's probably just a start. Because we're looking, again, as I go back to the funding mechanism that we have for EMS, fire, and police, we really need to revisit this, and how we make sure that our outstate partners can get the funds they need for everything. So I wish we could, just say this is a great magic fix, but it's not. And I really appreciate you working on this, Representative Backer. You've done it for years, since I've been in the legislature. And I think, I hate to tell you this, but I don't think your work is over yet. So thank you, Madam Chair.
Representative Whitty.
Thank you, Chair Moeller. Thank you, Representative Backer, for bringing this forward. I agree with Representative Hewitt. In an emergency, communication is important. In that inoperable moments where when the communication breaks down, that's when the problems happen. When in my former career, I was a part of rolling out the radio system and having a plan to kind of move forward, and unfortunately, it sounds like everything's kind of gone away. There's no solutions at this point. Many bonding and other appropriations for local projects require a local match of 50 or at least 25%. This requires a 5% non-match. Why such a low match? Would it be beneficial if it was a little bit more higher at that point?
Representative Backer.
Yeah, Madam Chair, and thank you, Representative Whitty. There's a report that was done by the Department of Public Safety, and the challenges that we have in not just greater Minnesota, but regional, and even in the metro area, a lot of our emergency care is done by volunteer fire departments and ambulance services. I'll use Browns Valley Ambulance as an example. Right now, every year, myself, my wife, and my twin brother, along with the staff, we do a fundraiser just so we can get the rig out, just so we can keep our expenses paid, not buying radios like the chief showed, the radio that is no longer operable, and we have those on our service. We raised $31,000, which is phenomenal. Roughly this year we did 37. So the reason for that low match is when we are out there and someone needs help, I think it's something the state should be doing. This is public safety. This is our responsibility, and I'm pleased that the chair decided to hear this bill from a member that's not from her party, because she recognizes that this is a non-partisan issue. This is safety. When any of your children or your grandchildren, your members need help, you expect them to show up. And I've had equipment failure. I've never had a radio failure, but I've had equipment failure. I had one about 7 weekends ago. Your stress level goes through the roof. Imagine if you have a school shooting and you can't communicate. I can tell you that's going to be stressful. I've been in, not that situation, but I've been in life and death situations that I've had equipment failure. And that feels bad. That's not why I volunteer. You want to be able to deliver that service to your children, to your grandchildren, to your neighbors' kids, and to your friends. So that's why I did the low 5%.
Any follow-up? Representative Woody.
Thank you for that answer, and we got to learn from our lessons. And after 9/11, they said the number one thing that cost a lot of lives in that was communication in the radios. So I'm supportive, and I hope this bill can move forward. Thank you.
Thank you.
All right. Representative Novotny.
Thank you, Chair Moeller, and thank you for bringing this bill, Representative Backer. As I just sit back, I think maybe we need to explain it, put it in a little different perspective of, instead of calling it a radio, let's call it what it is. It's a highly advanced computer that's got to be hardened to the point that it can withstand 30 below to 100 degrees above, and the daily banging of riding around in a car and falling and tripping and rain and snow and sleet, and think about your phone that you have to replace because it magically knows when your warranty is going to run out, and that crashes on you. In the meantime, you've got a portable radio, an 800 radio that's gone through, lasted longer than 3 of my phones. As someone who started law enforcement before we had a portable that was even worth carrying, we had the old fire pager. So once you got out of the car, if dispatch wanted you, they had to trip the fire pager. Then you had to find a phone. Once you've had a system like the Armor that works, it is great. And I think we need to, as everyone else would agree on this panel, on both sides, we can't go back. And I speak in favor of this bill. Thank you, Chair.
Thank you. Closing remarks, Representative Backer.
Yeah, thank you, Madam Chair and members. And I agree with Representative Novotny. He nailed it. Communication, and we heard from our testifiers, is the most important. If we do not know where to go and what to do, we can't use our skills to help people. It's somewhat similar to what happened to me Friday morning with helping Representative Keel. She knew who to call. Of course, she got a hold of me, and I was able to help her. It's no different than your constituents. When they dial 911, if it's fire, like Ortonville, if it's police, like what Representative Novotny served as a deputy, or myself and my other colleagues, when help is needed, we need to communicate. And also, back to Representative Whitty's question, 90% of all agencies in Minnesota, we have need some type of help because of the cost of this radio system. So really appreciate you considering this. This is so vital. This is so vital for public safety. And Minnesota is recognized across the nation to provide good emergency care, less still lead, and we need this communication channel continue to grow to be able to provide good care when someone dials 911. And hopefully none of you will have to do it, but if you do, we want quick recovery time for your family and your neighbors. So thank you so much. Take care.
Thanks again, Representative Backer, and to your testifiers, and to those who submitted letters that are in the members' packets and are online. With that, I renew my motion and lay over House File 1075 as amended.